This is a technique video on bridging reconstruction using BioBrace for large, massive rotator cuff tears, presented by Dr. Samora Maranya, Dr. Ivan Wong, Dr. Helen Crofts, and Sarah Remedios. These are our disclosures. The patient is positioned in lateral decubitus with 30 degrees of posterior tilt. Sterile draping and abduction to 60 degrees using a pneumatic arm holder is performed. Skin anatomic landmarks and portal sites are marked. Arthroscopic posterior, anterior superior, lateral and invisor portals. The posterior portal entry is performed and the rotator interval identified for anterior portal placement using an inside-out technique. A diagnostic sequence is then performed. Debridement and biceps sternotomy is also done in the standard fashion. Perform a subacromial entry and establish a lateral portal using an outside-in technique. A subacromial decompression and debridement of cuff edges is performed, and measurement of the tear is done with the probe. Place 2 triple-loaded helicoil anchors to the anterior and posterior aspects of the supraspinatus footprint. A super shuttle is used to pass a suture through the infraspinatus. Use a crochet hook to retrieve the second suture limb. The steps for first suture retrieval and passage into the infraspinatus are duplicated for the anterior supraspinatus. Grasp the second blue suture from the anterior goalpost anchor through the lateral portal and pass it through the graft. Make a tied loop using a switching stick to ensure easy suture retrieval once inside the joint. Pass sutures 1, 2, and 3 through the anterior supraspinatus using a spectrum via the anterior portal. The same method is used for suture passage through the medial supraspinatus, sutures 4, 5, and 6, using the invisor portal and posterior portal, sutures 7, 8, and 9, for the infraspinatus edges. Pass the second posterior goalpost anchor suture into the graft in a similar fashion to the anterior goalpost and make a looped knot using a switching stick. This provides for easy suture retrieval when inside the joint. The graft is then pushed into the joint using a closed grasper under gentle traction on all sutures and then viewed from the posterior portal to ensure the graft sits well, with the edges corresponding to the cuff borders. Grasp the second blue goalpost suture from the anterior anchor. Make an SMC knot to secure the graft to the cuff anteriorly. This step is replicated for the cuff posteriorly. Grasp the loops of sutures 1 through 9, followed by their respective partners on the anterior, medial, and posterior borders. A knot pusher is used to assist visualizing and grasping of suture on the medial supraspinatus via the invisor portal. An SMC knot is tied on all 3 edges to secure the graft onto the cuff. A double row fixation is then performed using 4 suture tails on the anterior and posterior footprint. For the anterior footprint, the sutures used are the 2 suture tails from suture number 10 and 3rd suture tail from anterior goalpost anchor and the 3rd suture tail from the posterior goalpost anchor. For the posterior footprint, the sutures used are the 2 suture tails from the number 11 suture, the 3rd suture tail from the posterior goalpost anchor, and the 3rd suture tail from the posterior goalpost anchor. This is a final view of the BioBrace bridging reconstruction construct, showing tension-free attachment of the graft to all 3 cuff edges and secured with a double row fixation.